Ultrasound in the PCOS. What is ultrasound? Why a doctor asks you to do ultrasound? Which day of the month you should do the ultrasound? What type of the scan is to be done? When a scan is done, what exactly a doctor is going to see in it? Which day of the month you should do the ultrasound? We are going to discuss all of these questions in our today's topic. Namaste. My name is Dr. Tanvi Mayur Patel. I am an endocrinologist, hormone specialist doctor from Mumbai, India. Before we continue this video, one important information. If you want to watch this video in Hindi language, then on the I button and below in the description box, there is a link. If you click on that link, then this video will be played in Hindi language for you. अगर आप आज के इस वीडियो को हिंदी भाषा में देखना चाहते हैं तो ऊपर आई बटन और नीचे डिस्क्रिप्शन बॉक्स में एक लिंक है। जैसे ही आप उस लिंक पे क्लिक करेंगे, इस वीडियो को आप हिंदी भाषा में पाएंगे। So let's continue our today's topic, that's ultrasound. First question, what is an ultrasound? See, ultrasound is known by various names. Many people call it as a USG scan or USG, ultrasonography or plain sonogram. All of that means the same. And this is a modern science technique wherein we take a help of the sound waves, and with the help of these sound waves we want to know the exact position, anatomy of your internal organ. Second question, the moment we ask any women to do ultrasound, they always ask, doctor, is this procedure safe? Answer is yes, it is 100% safe. See, in this scan we are taking help of sound waves. In no way we are using any radiations. So you will not have any radiation exposure. That means this scan technique is 100% safe. There are no short-term or long-term consequences of this technique. In fact, women who are pregnant, we do ultrasound for them. So you imagine how safe this technique is. So don't worry, if your doctor has asked you to do the scan, go ahead and get the scan done. Third question, why a ultrasound is advised in PCOS women? See, many of the times what happens that the women may have a body symptoms and may have a blood abnormalities. But we want to confirm the diagnosis of the PCOS and we want to document it. At that time also we do the ultrasound scan. Similarly, there are many situations wherein a women do not have any body symptoms, but their ultrasound shows that they have a polycystic ovaries. So in this kind of a scenario, to confirm the diagnosis, it's always advisable to do the ultrasound. But there is a drawback. Many of the time what happens that you might have a body symptoms, your blood parameters can also indicate PCOS, however ultrasound is absolutely normal, which is again quite common. And that is the reason why we take a holistic approach and we want to know in totality whether you have ultrasound or not. That is the reason why I have made another video wherein I have discussed on what basis you can help determine whether you have PCOS or not. If you want, you watch that video will be definitely helpful to you. Now, again, as per a Lancet study, there was internationally in a Lancet journal, it is documented that nearly 23 to 25% of the women who fall in the reproductive age group have a PCOS. However, only 5 to 10% of them have actual body symptoms. That means when we do this ultrasound, we can pick up the PCOS even in those women who don't have a PCOS symptoms. So that will be very important for the diagnosis. Now a question comes in a woman's mind that which day of the month I should get my scan done. Now see, in this question there are two answers. Many doctors feel that as day 2 or day 3 of your monthly cycle is an ideal time to do the scan. Many medical professionals want the scan to be done by 6th or the 7th day. So you ask your physician or your doctor that what day of the month he or she wants you to undergo the scan. Next question is that what kind of a scan is to be done? Now this is very, very important. See, in terms of the PCOS, the scans are done two types. The first is the external scan, wherein we take the help of the ultrasound probe, and that probe is kept externally on the surface of your abdomen area, and we are going to visualize it from the outside. Second type of a scan is an internal scan, also called as a TVS scan or transvaginal scan. Here we take the help of the ultrasound probe, and this probe is inserted internally into the vaginal area, and with the help of that we try to visualize your ovaries. Now internal scan is considered as a gold standard scan because internal scan is more reliable. See, understand, when we do the scan, we actually want to know more about your ovaries. And what happens, the cyst or the follicles which are there in the ovaries, they are mainly located in the periphery near the surface. And that can be visualized very easily with the help of an internal scan. Another issue is that when a woman who has a PCOS, they tend to have a weight issues. And because of their overweight or obesity, their abdomen area has lot of fat, and because of that visualization of the ovary can also be a challenge, and that is the reason why this problem is overcome when we do the internal scan. So that's the reason why internal scan is considered more reliable. However, there are certain situations wherein we do not advise internal scan, especially to those women who are never married or who have never attended a sexual activity. In those kind of a women, we tend to do a external scan. Many of the times, many women fear of having an internal infection. Again, we don't do internal scan for them, we ask for the external scan. Sometimes many women do not give a consent for the internal scan. Again, in those situations, the external scan can be considered. But yes, the gold standard technique is the internal scan. So you talk to your doctor that what technique of the scan you should be getting done. Alright. Now when the scan is done, what exactly your doctor is going to see in it? See, there are two main areas which a radiologist doctor wants to visualize. The first is the ovary. See, PCOS is actually a problem of the ovary. So that's where we are going to pay major attention. And if your ovary has more than a 12 number of follicles, and these follicles, the size is 2 to 9 millimeter, and if the ovarian volume is more than a 10 centimeter cube, we consider it as a PCOS. It is not necessary that both the ovaries should give the similar picture. Even one ovary has this kind of a criteria, you can have a PCOS. And when a scan is done, a very typical necklace-like pattern is visualized. Now, how a necklace with a string in that filled with the pearls. Similarly, this entire ovary looks like a necklace-like pattern, and that can also indicate a PCOS. Second area which you want to see is your endometrium. Now, endometrium is nothing but the internal lining of the uterus. We want to know how thick or how thin is your endometrial lining, and that can also help us in diagnosing of the PCOS. So these are the main areas which your doctor wants to see. Based on your ovarian picture, your doctor can also decide what is a antral follicle count or AFC. By the way, what is antral follicle count? I have made a different video for that. If you want, you can watch that video. That video will also give you detailed knowledge of it. Right? Next question is, how frequently you need to do the ultrasound? So see, when we want to diagnose you for the very first time, at that time definitely we ask you to do ultrasound. Ultrasound is usually not recommended every month to month. If your PCOS is well managed, is in the control range, then probably once in a year getting a scan done is advisable to check the prognosis. But otherwise, routinely we don't ask you to do the scan very frequently. Right? So I hope after watching this video you got some good useful information. If yes, please click on the like button. If you are new to my channel, please subscribe so that you get more and more health related information. And if you have any of your personal question whose answer you are seeking for, write that in the comment box below. I try to read and answer them as early as I can. We will meet again with some new good useful information. Till then, take care of yourself. Namaste.